lives through a national cancer screening program. More than 20 years ago, the Breast and Cervical Health Program started with the realization that women ages 40 to 64 with limited incomes and no health insurance needed access to quality women's health services. Because of that gap in services, Congress passed the Breast and Cervical Cancer Mortality Prevention Act of 1990, authorizing the CDC to create this program. Beginning with $30 million in 1991, the program currently has a budget of $215 million. This program is now a presence throughout the nation, in every state, 5 U.S. territories, and 12 tribal organizations. Over 20,000 healthcare providers participate in the program.
We save lives through access to clinical services. Because of BCCHP, there is a safety net for women to access life-saving cancer screenings that they likely would not otherwise have.
No one has ever given me something that had saved my life before. It was a lifesaver. With their help, my biggest problem was to be humble and accept this gift of life.
Connie was diagnosed with breast cancer. The program provides clinical breast exams, mammograms, pap tests, pelvic exams, surgical consultation, referrals to treatment, and diagnostic testing when screening outcome is abnormal. Since its inception, the national program has served more than 3.7 million women.
This program is a lifesaver in a lot of ways. Thank you.
Beyond providing clinical screening and diagnostic services, the program promotes public and professional education, supports patient case management, and provides tailored community education and outreach. These support quality improvement in clinical systems and addresses health disparities among priority populations. The Breast and Cervical Health Program, BCCHP, at Public Health Seattle and King County is a multifaceted program covering King, Kitsap, Clallam, and Jefferson counties. Since 1999, more than 109,000 women have received services in our 4-county area. Initially, we offered only 2 screening tests. Now, we offer over 100 CPT codes reflecting the standard of practice for preventive and diagnostic services.
We save lives through policy change. In 2001, legislation passed to create the Breast and Cervical Cancer Treatment Program, partnering with Medicaid for women diagnosed by the program.
When my test results came back saying that I had breast cancer, I told my provider that I wasn't going to get treatment because I didn't have health insurance. They told me this program was available and I had my biopsy the next day.
Federal funding has not kept pace with the ever-increasing need for services. On a national level, the program reaches only 20% of the potentially eligible women.
We save lives through advocacy. In 1998, we obtained our first state funding. Consequently, in Washington State, the program reaches 1 in 4 eligible women. The Washington State program has developed a network of providers and community partners who continue to fight for the high-demand dollars and are the voice for BCCHP clients in Olympia.
We save lives by developing strong partnerships. Our long-term partnership with the Puget Sound affiliate of Susan G. Komen for the Cure now provides nearly $500,000 for screening services, plus another $500,000 for local organizations for outreach, education, and navigation projects. Our partners are our strength. One of our partners told us,
You have been such a great resource. I made you this bracelet because it represents what you do for so many women. You give them hope in their fight with breast cancer or whatever issue comes their way. Thanks for all that you do. I really appreciate you.
we save lives by addressing health disparities. Priority populations for the program include women of color, lesbians, rural women, and women ages 50 to 64. Clients include women who may be working and are unable to afford health insurance or in jobs that do not offer health insurance. During the recession, the demand for services skyrocketed, and we responded by screening a record 8,700 women in 2009.
We save lives through outreach and education. The BCCHP outreach program operates by contracting with organizations that represent the priority populations. Community health workers tailor messages for women in their communities. We create partnerships to bring our clinical services to rural areas. Our unique approach for providing these services has increased utilization among underserved women because our mobile screening events are a safe environment in which to obtain care.
All of the people working there were great and made me feel comfortable. They gave me a lot of care. With most doctor visits, you have to wait a long time, but at the mobile mammogram, they were waiting for me. That was different. Thank you very much for the mammogram.
Outreach has successfully reached our priority populations. While our counties are predominantly Caucasian, 58% of our clients are women of color. Only 8% had received a mammogram within 2 years, and only 25% had had a Pap test within 3 years.
In 2005, BCHP at Public Health Seattle-King County was selected as one of 5 colorectal cancer screening demonstration program sites. We developed a system to provide quality screening built upon the BCHP infrastructure. In 3 years, because of our colon health program, 2,900 clients were screened for colon cancer. Our successful program was spread statewide with new state funding.
I am extraordinarily grateful for the Washington Colon Health Program, without which I probably would have delayed my colonoscopy. Good thing I had the colonoscopy done. They took out a 1-inch in diameter polyp. I was completely asymptomatic. So what if it had been cancerous, and what if I let it slide another year? I might be facing a metastasized cancer diagnosis.
Our pilot program was adopted as the model for the CDC's national program that was rolled out in 2009.
We save lives through evaluation. We discovered the challenges and barriers to screening in specific communities, such as African American and Russian-speaking women. We created innovative education programs for the Latina and Vietnamese communities and developed messages that address those communities' concerns.
We save lives by providing services that our clients otherwise would not have received. We contribute to the quality of life of our community by providing assistance to the public that calls.
I just wanted to say thank you so much because I have tried so hard to find anyone that would help me. You are my last hope. That's not enough words for me to say thank you. I am so grateful. If it wasn't for you, I wouldn't be able to get any of this done. So I just want to say how much I appreciate it.
During the past decade, we've been recognized for our work on a local and national level. BCCHP will be evolving again as the Affordable Care Act is implemented. We will save lives through patient navigation to offer a path for the clients and communities that we have served. We will save lives by consulting with healthcare providers on developing systems to provide screening services, tracking, and follow-up. We will save lives by training community health workers and developing culturally tailored health education materials.
To the world, you may be one person, but to one person, you may be the world.
It could save your life.